The body tries to relieve itself from this distress by expelling excess fluids. In other words, a mechanical nervous reaction begins. Symptoms such as diarrhea, vomiting, and cold sweating are manifestations of this process. These symptoms are actually an attempt by the body to restore the low body temperature and salt deficiency caused by excessive fluid loss. If this mechanical stimulation continues for too long, excessive loss of fluids causes the blood to become thicker, and the body temperature drops even further. The remaining salt cannot be properly digested or absorbed because of the lack of fluids and inactivity of the glands, or it becomes insufficient. In such a condition, the patient's urine becomes extremely red and acidic, and if tested, the pH level may fall below 5, indicating that muscular stimulation has developed. Note: to understand the pH test, read my article on pH available in the group. Understanding the question about cholera. A question arises. If cholera initially occurs in nervous stimulation, then once muscular stimulation appears, the disease should improve. However, the answer to this question is rarely explained. The explanation is this. In the early and mild stages of nervous mechanical stimulation, when the immune system is strong, muscular treatment may work. But in severe conditions and extreme weakness, muscular treatment can worsen cholera. The reason is that at this stage, the body has already lost fluids, salt, and heat, so the patient no longer has the strength to digest or absorb muscular medicines. In other words, the body is extremely weak and continues to lose fluids. Because of this severe deficiency of fluids, cells and blood vessels collapse. Blood pressure becomes extremely low and vital heat almost disappears. At this stage, if water and salt deficiency are corrected, the patient can recover quickly. This is why giving saline solution, salt water, intravenously is considered one of the best methods in allopathic medicine. However, sometimes giving too many saline bottles can cause complications again. Therefore, once the deficiency is corrected, saline drips should be stopped. Avoid muscular medicines in cholera. In diseases like cholera, muscular medicines should not be given. Some traditional physicians have recommended muscular treatments such as tamarind, Tamarindus indica, dried plum, prune, Prunus domestica, Jawarish tamarhindi, tamarind digestive preparation. These substances may stop vomiting temporarily, but they do not cure cholera and sometimes provide no benefit at all. For this reason, Saber Multani, RA, recommended treating cholera with glandular medicines, which help quickly restore heat salt body fluids. Medicines such as Tiriac A meta, Hazm, number 5, Namcol, oral saline solution, are considered very effective. If symptoms are only beginning and resemble cholera but are still mild, medicines number 3 and number 4 may also be given. Sunstroke and salt loss. During the summer season, some people suffer from sunstroke due to excessive exposure to sunlight. In this condition, salt and water are rapidly lost from the body. In such cases, the best treatment is again salt solution, Namcol, oral saline, medicine number 4. Some people believe that since heat caused the illness, cold drinks should be given, such as drinks made from 4-seed mixture, charmags, poppy seeds, Papaver somniferum. However, this does not address the problem of low blood pressure. Proper treatment only becomes possible when the nature of the disease and its mechanism are correctly understood. Homemade oral rehydration solution. If Namcol is not available, it can easily be prepared at home. Salt, 1-2 teaspoon, sugar, 8 teaspoons, sodium bicarbonate, baking soda, a small pinch, water, 1 liter. Mix these together and give the patient small amounts repeatedly. If available, add 1-2 drops of extracts of ajwain, Trachospermum amiceeds, and mint mentha species in equal quantity. This will make an even better rehydration solution. As the patient begins to tolerate fluids better, gradually increase the quantity. After that, herbal teas can also be given, such as bay leaf, Cinnamomum tamala, tea, mint tea, ajwain tea, celery seed tea, Apium gravulans. Sweetness can be added with honey or sugar if honey is not available. Liquid foods should also be provided. Treatment of delirium. Some patients may develop delirium or mental confusion during illness. This condition is treated by shifting stimulation from muscular glandular to glandular muscular activity using strong medicines. If those medicines are not available, a simple remedy can be used. Give the patient several black pepper seeds, Piper nigrum, to chew continuously. The patient should keep chewing and swallowing the seeds and then continue with new seeds. Continue this until improvement is observed. In many cases, black pepper alone cures about 90% of patients. Key principle of treatment. The main lesson here is to first identify the type of stimulation involved in the disease and then prescribe medicine accordingly. If the condition is glandular, treat with nervous medicines. If the condition is nervous, treat with muscular medicines. If the condition is muscular, treat with glandular medicines. However, remember an important point. This formula does not work in every situation. To understand why nervous diseases are sometimes treated with glandular medicines, read the post again carefully. The explanation will be given in the next part.